Hi, this is Dr. Kaye Christopher. Today we're talking about the journey of weight loss. And our topic is how do you develop type 2 diabetes mellitus? First off, I want you to understand the disease is a disease that is defined as insulin resistance. This means that your body, your pancreas, beta cells in your pancreas have the capability of producing insulin. It is stimulated to produce insulin after you've eaten. And the reason your body needs to produce insulin is because insulin is the key that unlocks the door to muscle cells, liver cells that allow glucose into those cells to provide the energy the body needs for your metabolism and keeping you energetic and functional. So, step one, you eat. Step two, once the food is digested by the gut microbiome and absorbed, it's in your bloodstream and it's going to the different cells. Number one, there are receptors on your muscle cells, on the liver cells, and those receptors are the receptors that insulin that's produced from the pancreas binds to. So picture you have a key in your hand, that's your insulin, and your insulin, you're sliding that key into the lock. Now, you turn the knob and that allows the glucose to bind to the muscle. The muscle takes in the glucose and uses it in the machinery to convert that to energy for your body. The caveat is, over time, the cells are saturated with fatty acids because that's the most efficient format of energy that the body can store, fatty acids. So over time, as you overeat or your energy expenditure is less than your intake, the storage of that excess energy is converted to fatty acids and it deposits all over your body, in muscle cells, in your liver. And so what happens is, once those cells become saturated with fatty acids, then when the insulin comes to bind to the cell, it'll find that it no longer fits. It can't, the acid, the fat has changed the format of the receptor, and the insulin cannot bind as effectively as it used to. Therefore, you cannot turn the knob of the door to allow the glucose to bind to the cell to get in. So the glucose stays in the bloodstream. And now, because that level of glucose is so high in the bloodstream, it sends a signal to the pancreas, hey, we're out of insulin. We're out of insulin. Send more insulin. We need more insulin. Eventually, initially that works. A higher dose of the insulin will then bind to those receptors, unlock the door, and allow glucose in. Over time, even sending that signal back to the pancreas will not be enough. And your body does not respond to your own insulin. And that's how you develop insulin resistance. It's not that your body doesn't have insulin. It's the fact that the insulin your body is producing, because of the fat that's been deposited over years in those cells, it cannot be recognized by your own body and therefore becomes ineffective, causing you to have high levels of sugar in your blood, resulting in diabetes. Now, I want you to know what are the symptoms of having this high sugar in your blood. Number one, it causes you to lose water. The sugar in the blood pulls water out of the cells. Remember, I told you your body is made up of 60% water. So that water that's in your cells will be shifted out of the cells, and it's now in your bloodstream. Once it's there, then it causes you to have what we call polyuria, frequent urination. Polydipsia, it's going to make you thirsty. One of the key things about rapid weight loss is the fact that the first thing you lose is water. So here goes. You're doing all that urination, you're losing weight. You're tired, your body is dehydrated. Dehydration is a source of fatigue. So you're going to be tired, thirsty, frequent urination. It even causes you to feel hungry, because the signal that your body, the cells of your body is sending off to the brain is that we have no energy. The sugar is in the wrong space. It's in the bloodstream. It's not in the cells. So therefore, your brain is going to say, okay, eat some more sugar, eat some more food. I need energy. You get blurred vision. Over time, you have problems with the nerves in your body. You start having what they call hand and feet neuropathy, and it's in the distribution of glove and sock. So if you envision put in your mind's eye, putting on your sock, that area of your foot and leg where your sock would normally go, that area starts to have tingling and numbness. And you will have the same sensations, tingling and numbness, as in your hands as if you were wearing a glove. Okay? Now, understand that neuropathy, it starts out with tingling and numbness, burning, and eventually progresses to complete numbness, where you lose sensation when you step on something, and you have that creates a nidus that sets you up for developing a sore, eventually a pustular lesion, an abscess, a non-healing ulcer, and can lead to limb loss. As a matter of fact, diabetes is the number one cause of limb loss in the United States. Okay? So this concept of the overeating resulting in the high levels of free fatty acids that the body has to store somewhere. They're deposited all throughout your body, in the muscles, in your liver, and over time, it changes the insulin's ability to bind to the cells and allow those cells to take up glucose for energy.